Hello, everyone, and welcome to Introduction to Sociology. And this is the lecture on medicine and healthcare. So let's get to it, I guess. Medicine and healthcare. Here we go. So I want to start off by talking about the Affordable Care Act, also known as Obamacare. I'm sure you've all heard of it. Um, and but most of you probably couldn't give a comprehensive and intelligent explanation of what it is. And the reason why is because the Affordable Care Act, or Obamacare, is basically a synthesis or an amalgamation of many healthcare policies. So it's pretty crazy. Okay, so we'll get down and dirty here about what some of the things it contains. Okay, um, first of all, it has a lot of mandates, and one mandate is that insurance companies can no longer deny coverage to those with pre-existing conditions. Okay, before the Affordable Care Act, if you had a pre-existing condition, insurance companies could and did deny coverage for many people, and many people could not get health insurance. The Affordable Care Act has forbidden this practice. Insurance companies have to pay 80 to 85% of healthcare premium dollars on patient care. This is because a lot of the cost of healthcare has administrative costs. In the old system, it was about 31% of healthcare spending. So if they didn't keep it to between 80 to 85% of healthcare premium dollars on patient care, some people might get refunds. Okay, I haven't heard of that happening really, but that's part of it. They have to provide some preventive health coverage without deductible or copayment, and this includes, except for some exemptions, birth control. Okay. Insurance companies cannot drop you if you get sick or have annual or lifetime dollar limits. Okay. There's now the individual mandate. Okay. Individuals must have insurance. This is called the individual mandate. If the individual does not have insurance, they pay an extra tax to the IRS. Okay. The Supreme Court upheld a challenge to the individual mandate. However, it was repealed in tax reform legislation. Okay, and I'll get there in a bit. So basically, it's not enforced. There's also a court case going on right now on the individual mandate saying that because the individual mandate is repealed, it's no longer considered a tax. Therefore, the whole law is invalid. We'll see how the Supreme Court rules on that. Okay. Let's see. It creates health insurance exchanges in which individuals buy insurance on the open market. So you may have familiar with something called Covered California. Covered California is something that's your health insurance exchange if you're in California. If you want to buy insurance, you go to the exchange, and supposedly, since they compete against one another for your dollars, and there's this big kind of group rate, health insurance premiums go down. Okay, the expansion of Medicaid to provide assistance to those who make under 138% of the federal poverty level. But the Supreme Court struck it down that mandates the states to expand Medicaid. In other words, the federal government cannot force the states to expand Medicaid. So a bunch of states, at the time about half of them, decided not to expand Medicaid. So that kind of leaves their poor kind of in the lurch. Okay, so also, employers of 50 or 50 full-time equivalent employees must provide health insurance or pay a penalty. Okay, so many employers did cut back a little bit on that. So, on what was full-time. Okay, so as I said, This was a combination of many healthcare policies. Jill Quadagno. Okay, let me get to the consequences of the repeal of the individual mandate here. Okay, first, this is according to the Kaiser Family Foundation. The individual mandate reduced the number of the individual mandate itself reduced the number of uninsured from 43 million in 2013 to 27.6 million in 2016. So about 16 million people or so, 15, 16 million people or so, got health insurance. Because of the individual mandate. According to the Congressional Budget Office, repealing the mandate will result in 4 million more insured by the end of this year, 13 million more uninsured by 2027, and a 10% increase in premiums in the non-group insurance market. Okay, so let me go on about this relationship between the individual mandate and the mandate that insurance companies cover everybody. Insurance companies were saying that if you want us to cover everybody that applies, then all people have to apply. The logic here is that the people less likely to have health insurance are the young and the healthy. So they don't buy in. So what it ends up being is that the older and sicker people are the ones the insurance companies cover. So they're saying, okay, we can afford to do that if everybody buys in. Now, if there seems to be this kind of a contradiction going on, because if the individual mandate is repealed, insurance companies will have to increase their premiums by a lot if they must cover everybody that applies. Okay, so this is part of a problem here. This is the way insurance works. You pay into something, and when somebody else needs it, they get it out of your premium dollars, but when you need it, somebody else is paying. This is how insurance works, and the risk is spread throughout the population. Okay, so let's get a little history lesson here on the basis of Obamacare. It's from Jill Quadagno, Right-Wing Conspiracy, Socialist Plot, The Origins of the Patient Protection and Affordable Care Act. Okay, this is from Journal of Health Politics, Policy and Law from February 2014. It's a little bit of a history lesson here. Okay, so the Affordable Care Act was not brand new, based on years of policy proposals. First of all, mandates. For employer mandates, it was first proposed in Nixon's Comprehensive Health Insurance Plan, okay, in which the employer had to provide health insurance. But there was a problem. Some people feared something called job lock, or the inability for workers to leave jobs because of losing benefits, okay? So, to address job lock, somebody named Stuart Butler from the Heritage Foundation said, quote, said that there should be an individual mandate. Butler says, quote, this mandate is based on two important principles. First, that health care protection is the responsibility of individuals, not employers. Second, it assumes that there is an implicit contract between households and society based on the notions that health insurance is not like other forms of insurance protection. If a young man wrecks his Porsche and has not the foresight to obtain insurance, we may commiserate, but society feels no obligation to repair his car. But healthcare is different. If a man is struck down by a heart attack on the street, Americans will care for him whether or not he has insurance. Each household has the obligation, to the extent it is able, to avoid placing demands on society by protecting itself. So this mandate was also included in George Bush's Comprehensive Health Reform Act of 1992. Okay, This was a Republican idea, the individual mandate. Okay, so let's go through something called, it was a Republican idea in the Clinton years. Clinton proposed, I'm just going to skim this a little bit, proposed something called the Health Security Act of 1993. It didn't make it onto the floor of Congress, but he proposed health alliances that would bargain with insurance companies as were standardized health plans, and they would provide standardized health plans and insurance company regulations. The insurance companies fought this with commercials from Harry and Louise. Okay, you will, you can look this up on that YouTube link if you want, about the Harry and Louise commercials. Okay, so the health insurance industry didn't like this plan because, about the regulations it would place on it, so they fought it, okay? But Republicans came back with something called the Health Equity and Access Reform Today Act, or HART, okay? About half of the Republicans in the Senate supported it, but it had difficulty moving through because of resistance from other Republicans. It had mandates. It had regulations of the insurance industry. It had a standard benefit packages, but not enough Republican support. There were a couple other laws that played minor roles here. The on insurance company regulation, something called HIPAA, Health Insurance Portability and Accountability Act of 1996. That mostly deals with patient privacy issues, but it had things like limits on pre-existing condition exclusions and things of that sort. Some limits on individual coverage, and puts limits on health insurance companies regarding things like renewals. So some minor things there. I think that's where COBRA came from too, which if you ever had to deal with COBRA, it's a nightmare. Okay. Medicaid as well. Section 1115 of the 1965 amendments to the Social Security Act, which allows for states to apply for waivers to conduct research and demonstration projects within their Medicaid programs. Okay, so also this led to a state children's health insurance program as an expansion of Medicaid for children, okay, called SCHIP. Okay, those are kind of minor things, but they do come involved here. So some people like this so much that they put it in the Massachusetts Healthcare Reform Plan under a governor named Mitt Romney. Okay, it had state insurance exchange. Okay, it had an employer mandate. It had an individual mandate. Mitt Romney said, quote, "No longer can individuals free ride by seeking health care and expecting society to bear the cost." So Romney, a Republican governor, it provided subsidies for adults under 150% of the poverty level and children under 300%. Okay, it led to 98% coverage by 2010. There's something also called that Healthy Americans Act. It didn't pass, but it had the individual mandate as well. Okay. It also sought to eliminate the tax benefit employers get by providing health care, and that was controversial. So then we went on to the Patient Protection and Affordable Care Act. Okay, so remember back here, I'm talking about HART, okay, the Health Equity and Access Reform today. Okay, here we're talking about the Patient Protection and Affordable Care Act. Let's compare them. Okay, I hope you can see this. This is right from Quadagno, right from her article. They both had individual mandates, both of these bills. They both had fines on employers. They both had standard benefits package. They both had bans on denying medical coverage for pre-existing conditions. They both established state-based exchange purchasing groups. They both offered subsidies for low-income people to buy insurance. They both improved the efficiency of the healthcare system. They both equalized tax treatment for insurance of the self-employed. They reduced growth in Medicare spending, controlling high-cost health plans, and that's you can see there how they did it. Prohibit insurance companies from canceling insurance. Yes. The ACA prohibited insurance from setting lifetime spending caps, but HART did not. The expansion of Medicaid, the ACA did, HART did not. Okay, extending medical coverage to dependents up to age 26, the ACA did, HART did not. There are some differences here, but generally the ACA reflects many of the major aspects of HART, of the HART Bill of 1993, which was a Republican idea. Okay, so today we hear about this, though. When we hear about the debates, we hear that the Republicans are against the ACA and HART is Republicans against the ACA, Democrats for it. Okay, yet much of that same thing. Much of this was like a Republican plan, okay, so from 1993. So there are many reasons why that could be. I'll leave that up to your analysis to figure out why that is. If you're curious as to what I think, send me a message. Okay, so the Affordable Care Act is an amalgamation of many policy proposals, some enacted beforehand, but most not. It's neither a right-wing conspiracy nor a socialist plot. Okay, so we still have a problem. In 2017, 27.4 million Americans uninsured, and it's getting worse. Healthcare expenditures in 2017. It's $3 trillion, and that came out to, okay, and it's reaching 3.5 trillion. Okay, those were the last things I had, but it was $10,739 per person. It is 17% of the gross domestic product. We spend more money than any other country in the world on insurance, both in terms of dollars and the percentage of gross domestic product. Yes, we are, but yet we are not the healthiest. Okay, so there's many reasons why we're not the healthiest. Part of it has to do with our environment, our diet. That like some medical practices make things worse, such as we call iatrogenic medicine. Okay, so it's we're not the healthiest people as measured by, say, life expectancy. Japan ranks up there as number one or close to number one year in and year out, depending upon how the data are counted. Okay, so costs keep going up and not everyone is insured. And so there are a lot of ideas out there, including Medicare for All that you may have heard about, also known as single payer. Okay. In the last Congress, there was a bill, and there's another one passed this time, but I'm looking at this bill in the last Congress because there's been academic analysis of it. This is in the 115th Congress, introduced S. 1804, Medicare for All Act. Okay, it would, over a 4-year period, enroll everyone in Medicare, cover all sorts of things. Okay, I'll just list it all here. It's not on the slide. Okay, inpatient and outpatient hospital services, ambulatory services, primary care and preventive services, chronic disease management, prescription drugs and medical services, mental health and substance abuse treatment, laboratory and diagnostic services, pediatrics, reproductive, maternity and newborn services, oral, hearing, and vision services, and short-term rehabilitative and habilitative services. Okay? It did not cover long-term health, but I believe now in the new bill that long-term health insurance, like long-term care insurance, is part of that too. So an analysis was done about how to pay for it by the University of Massachusetts Political Economy Research Institute. Okay, how would it be paid for? One, okay, business premiums, first of all. Right now, employers pay into healthcare insurance. You continue that with a cut of, say, 8 to 13%. So businesses still pay, but they pay less, okay? A 3.75% sales tax on non-necessities, okay? A net worth tax of 0.38%. Exempt on the first $1 million. So on your first $1 million of net worth, you pay nothing. For the amount after that, you pay 0.38%, which is not very much in my opinion. Okay, and taxing long-term capital gains as ordinary income. So right now, capital gains tax has been reduced over the years to, to very little. Could be like zero by now. Who knows? Could look that up, I guess. So if we tax that as ordinary income, how we usually get it through paychecks and things like that, then then that's part of the idea. To be clear, what a capital gains is, that's the profit you make on investments and things like that. So, for example, if you buy a house for $500,000 and after a few years you sell it for $1 million, your capital gains is $500,000. Okay, so that's taxed at a lower rate than ordinary income. And some people say that we should tax it at ordinary income. Okay, so what would be the result? Net healthcare costs for middle income families would fall between 2.6% and 14%. Okay, for the top 20% of income earners, they would see their costs rise by 3.7% in terms of healthcare. Okay, so the top 5% would see it rise by 4.7%. It would reduce overall healthcare spending by 10%, and over 10 years, it would save $5.1 trillion. Okay, so most generally with healthcare, we would spend less. A few people would spend a little more between. For the top 20%, okay, but for the bottom 80%, it would fall. So what they pay in healthcare, what they pay, they pay it in taxes, but they wouldn't pay it for premiums and co-pays and all of that. So it would reduce the cost for most Americans, but not all. So, and overall, healthcare spending would save $5.1 trillion. So that's all. I hope you have a good time watching the video. This time it's one of my favorites. Okay, and I will see you next time.